Hello, everyone. I'm Traci Arieli, end-of-life doula and founder of Comforting Closure. Welcome to another episode. Today, I am honored to have Sam Madison, co-founder and chief operations officer of Thanacare, joining us. At a young age, Sam lost his mother to breast cancer. That experience opened his eyes to the disorganization surrounding how we experience death in our society. As an adult, Sam and his father, a longtime doctor, channeled their grief into creating Thanacare, a platform dedicated to ensuring that individuals can document and communicate their end-of-life wishes clearly. In today's episode, we'll discuss the critical importance of advanced directives and planning for a good quality of life as we age. We'll discuss how to ensure that doctors and medical staff follow your wishes and the best ways to communicate those wishes. So whether you're a death care professional, someone caring for a loved one, or just interested in planning for the future, this episode promises to be insightful. Sam, welcome, and thank you so much for being here.
Thank you, Traci. Nice to be here.
Sam, can you start off and share your personal journey that led you and your father to create Thanacare?
Absolutely. So, as you mentioned, I lost my mother when I was 6 years old. That obviously had a profound impact on me. I very detailed. I remember all the details very clearly about her passing and the quick diagnosis that we received around Halloween time, and she was gone only a few short months later due to the aggressive form of cancer. And the disorganization and the unpreparedness that we had, even with medical professionals inside the family, really sparked the idea for Thanacare to begin to gestate. And years later, we built upon my father's professional experience. He is a interventional neuroradiologist, treating strokes and aneurysm patients. So you can think about the common case of a woman who presents 90 years old with stage 4 dementia, and she's had a stroke. Now, the option to proceed with removing the blood clot and restoring her quality of life is a delicate one. It's not always going to occur. So we were using our personal and professional experiences to really create a solution that allows people to really grab hold of that autonomy at end of life to ensure a quality of life during their end of life care.
Yeah, so your father had, you being a doctor, that must have influenced the mission so much in Thanacare.
Absolutely. Our mission, really, at the beginning, was a one-line sentence of how do we reduce family squabbles at 2 in the morning? How do we get people to prepare for this inevitable occurrence that we all face? Now, 20% of the people have what most of us would like, a sudden death, something that's not prolonged, something that is quick, something that is relatively painless. But for the other 80%, of us, we are going to be running into these decisions, and we need to make ourselves known to these decisions and make our loved ones and those who are around us known to these decisions and how we'd like to be cared for.
So that might feed into my next question, which is what do you see as the most significant barrier to having an advanced directive in place?
So there's two, I think. Death phobia. The death phobic nature of the American society is a difficult one to overcome. There are multiple barriers to getting these healthcare directives completed. First, starting the conversation with people concerning their own death and discussing their wishes and their best life for their end of life. It's tough. But that is something that we're trying to overcome day by day. And we see this groundswell with people like yourself having the conversation, with putting content out there in the world for us to consume and reflect upon. It helps that very difficult job of getting people to embrace their serious illness conversation and their end of life conversation. So the first part is really to get that individual to decide who will be their trusted decision maker, and then getting everyone to align around what those end of life care wishes might be. So that when someone becomes incapacitated and not able to make decisions for themselves, they have that person. to speak for them and to enact their directions. So it's death phobic is kind of the biggest hurdle. And then the second one is access to healthcare directives. Unfortunately, with the COVID-19 pandemic, the that it really demonstrated the wide disparities of access to care throughout America. And that allowed us to really insert ourselves as Thanacare to become people's go-to application that allows them to document and distribute their healthcare directives. So currently, in the United States, at best, only 10% of the people have completed their healthcare directives, and we're working day in and day out to inch that percentage northward, so we can all have a little bit more ownership and confidence in what is going to befall us all, of course.
So the actual platform that you have created, the technology, is it to be used, or can it be used by everyday people who who aren't in the industry, the healthcare industry? If my parents wanted to get on it and start to look at some of those questions that you have, would they understand?
They can, would they understand? That's the tricky part, Traci. What we found early on is that death is not really a self-service industry. We don't really understand what DNR DNI means for us. We don't understand what tubes might mean as it relates to CPR. So what we found is that people like yourselves, death doulas, death care workers, even chaplains, licensed social workers, really anyone who has this responsibility for end of life care, they are the best ones to lead community members through this conversation because they've had previous experience and they meet the people where they are, whether it's at the home or in the parish or at the church bench, or maybe it's out on the park bench. People are having this death conversation kind of all over the place because people are all over the place when it comes to death. We just don't exactly know how to approach it as individuals.
I've had additional training on advanced directives. I did not know about the actual outcomes of CPR and the percentages and what that really means. And it's really interesting because I try to have this conversation with my parents who are in their 80s, and it was a very difficult conversation. They didn't want to talk about this. And I've told this story before on the air, but my father had a stroke in January, and he's fine. But I was in the emergency. I happened to be visiting, and I was in the emergency room with him. And the doctor walked in and asked, "Mr. Stahl, I have to ask you this. Do you want CPR?" And of course, my dad was like, "Yes, you keep doing CPR. You wake me up again and again." I'm like, "Dad, I thought you said you didn't want to be put on a ventilator." And my dad's like, "No, I don't." And so I turned to the doctor, who was a young guy. I felt really bad for him. I said, "Doctor, what's the likelihood that you're going to crack his sternum, you're going to break his sternum, and he'll be put on a ventilator?" And the doctor looked down and he said, "Yeah, that's going to happen." And I said, "What's really the likelihood that he's 80 years old? What's the likelihood that he will make it, even doing CPR, to walk out of this hospital?" And the doctor at that point just looked down at the floor, shook his head, and was like, "Yeah, not very good." So that conversation that you're saying, that people who need to lead, who really understand the realities of what CPR is and what all of these things on that piece of paper mean is really important, because it's not like what we see on TV.
No, it's not, and that's not going to get any better. I'm in Los Angeles, and the Hollywoodization of death in America is not reflective at all of what we go through at the end of life. So it's on us to be curious as individuals too, to go onto YouTube, to talk to people, to say, what does this actually mean for me? What does it mean for my disease? What does it mean for my disease progression? And how might I best ensure that my quality of life could be upheld to a point where I'm comfortable, whether it's in the hospital or outside of the hospital.
what's the normal process? What's the normal procedure if a person doesn't have an advance directive? What have you seen? Because I've seen things, but I'm curious about your experience with that.
Yes. So what we've seen is we've been trying to really preach the healthcare power of attorney. Now, this is something that not everyone has. There are a growing number of solo agers in America who do not have this personal network that they can call upon. But for those that have the idea to say, this is my healthcare power of attorney, or this is my second, this is my third person who might be able to speak for me, that's where we've been trying to get the foothold in, because that begins to form a team. You have to kind of understand who this 9-man baseball team is, who's in the outfield, who's behind the plate, who's in the infield. So you're trying to really situate people, and then you begin to reflect about what those end of life wishes might be for me as a result to DNR, DNI, CPR, or other life sustaining treatment, and so forth. So really making it more tangible between the personal networks allows for that conversation to kind of flourish and to kind of breathe, because you know one of the most difficult things in America is that this end of life care conversation, this advanced care planning conversation, has been left up to the primary care doctors at the annual wellness visit. And they have 15 minutes to have this conversation with you at best. But we all know that that's not sufficient by any means. So stopping and starting is kind of the best way to go about it. And starting with identifying who your people are is kind of a more tangible way to kind of grow what your end of life care might be. So you can document it and then ultimately distribute it to those people who need it, those people around you, and then ultimately those healthcare professionals around the places and communities in which you live.
Usually, when I am working on an advance directive with a person, it's not that 20-minute conversation. It's, not filling out a piece of paper. In fact, that doesn't even get done in front of the person. I usually, that's it. What it is talking to that power, the healthcare power of attorney, having them there when we talk about all of these decisions that we need to make and all these factors. But not only do I have the initial, that primary power of attorney, but I have a secondary, because you never know what might happen. And sometimes I even have family members. Their spouse is definitely there if they have a spouse, but sometimes other family members want to come and we have a follow-up to talk to them about it, because that piece of paper only goes so far, as you know. It could only take in a few scenarios. And so having a person having that conversation with the people that understand the whys behind your decision is necessary, and it's important.
It's so vital. It's the documentation is one thing, just like you said, Traci, but then moving on to that alignment, getting everyone aligned around what their game plan is when the inevitable occurs, or when if we're able to have that graceful death, to be upheld to graceful death as well. So it's not necessarily an emergent scenario. So alignment bolsters everything to the point of it being making that documentation truly meaningful.
Yeah, and it's such a service to your family and your loved ones to do it, because there's nothing worse than being called to the hospital and having your sons and daughters really not knowing what to do, and there could be disagreements. So it's really a service.
It is. And it's, there's this syndrome in America called the daughter from California or the son from California, who flies across country and completely fights with what the wishes that were documented, because there just been a point of in communication between the two parties, and that leads to the over treatment, the over medicalization. You hear about the medicalization of death, that a single step that an individual can do to ensure that they're not overtreated by the medical system or by a family member who might not be in the know, is really having these conversations and getting that trusted medical decision maker in place with the power to do so, to really uphold what you as an individual have articulated as the ideas of the best life for me. best life for me in this scenario.
So after everyone died, we have the conversations, we document, we everything's in Thanacare, everything's laid out. What are the practical steps that individuals take to ensure that their medical wishes are followed by doctors and medical staff? And I remember talking with you, and you pointed out a QR code functionality, which I thought was just the coolest thing. So if you could talk about that a little also.
Yeah. So what we've done with Thanacare is digitize this end-of-life care process of documentation, whether it's advanced care planning documents, the post form, most form, or really any of these other directives that these medical professionals are trained to look for and trained to respond to. So we've wrapped that up with some modern accents like the QR code. So, that QR code really stems from the idea of a snowbird. These snowbirds who might travel from Minnesota down to Florida, Minnesota down to Arizona, they're typically carrying their advanced care directives in paper form, sometimes in a 3-ring binder, just taking up space and not necessarily easily they could fall victim to a coffee spill, for example. So it's about kind of modernizing that aspect of it. So this QR code acts as it's a laminated business card that is in the wallets. It's in glove compartments. It's distributed to family members. And as you scan that QR code, it pulls up the advanced directives. So they're able to take the QR code from one community, maybe northern Minnesota, and then go down to the Phoenix area and then share that QR code with the hospital that they're near, for 2 to 3 months out of the year, for example. So it's about making the end of life care wishes a piece of traveling information because our healthcare systems don't talk to each other across state lines. The Epic system is a closed, the server system is a closed, it's a little bit of a prison. It's not a great user experience. It's more of a billing code system for the hospitals to ensure that their money is being made. So giving autonomy back to individuals through just modern accents like a QR code helps um, make it known what their wishes are wherever they may be.
As a daughter, let's pretend my parents do have advanced directives. As a daughter, can they send me that QR code? Can I have it on my phone, or so everyone, me and my brothers, can have access to this?
Yes, yes. So we like to preach both have it on your phone and then have a physical copy as well. And so then we also send the directives via email as an attachment, not only to the family members, but to the primary care provider or to the nurse that might be overseeing this patient. So it's about distributing these documents and these wishes once they're done in all the different facets that may be available because previous to this, it's just hard to kind of always snail mail things around. So you're able to really expedite the transfer of knowledge around end of life wishes.
Yeah. And I know that you also have a video portion in your platform. Can you talk about that a little bit and why it's so important?
Yes, the video portion goes back to that one line of business focus that we had at the beginning of Thanacare, which was to reduce the family squabbles. So if you can look at a piece of paper, you might be able to ignore a piece of paper and tell the doctor to do whatever you can to save my father, for example. But if you have his video, his voice, his intonations, his eyes, his smile saying, I've thought a lot about this. This is what I want for my life. Please respect my wishes. And wrapping that and putting that video along with the wishes is a really powerful combo that allows for just a better understanding or an ease of understanding. And so video wishes have been really, really powerful. I think, we've been seeing video wish applications and videos in general as a documentation mechanism that helps kind of situate people and progress as they progress along their disease. They're taking different video snippets and saying, "Here I am today in December of 2019. Here I am today in December of 2021, for example. So just kind of seeing where you're at different points helps really elucidate the disease progression and the care that's being given. So video is a really powerful tool, not only for the family members, but then also for the medical professionals as well. It humanizes someone off a piece of paper.
Yeah. It's interesting that you mention coming back a year later and giving updates. People always ask me, how often should I be looking at my advanced directive? And my answer is, well, if you're healthy, you're totally, my husband and I are totally healthy. We're not going anywhere, knock on wood, anytime soon. It's every 2 years. I tell people every 2 years, but as you get older and if your health changes, you need to look at that. You need to look at those choices more frequently. And so you're able to update it very easily in your platform.
Exactly. You're able to submit any video you want at any time. You're able to submit text and images at any time to kind of just update your directives. And that's really where we see a lot of uh, returning ownership to the patient. Previous to there was an old TV show, Dr. Marcus Welby, that individuals with I think James Brolin, I believe, and he walked people from their home into the clinic, or he walked people in from their home into the doctor's office to have this conversation. And that's a lot of autonomy for someone to have a personal attendant such as that. So giving them the power of technology along with end of life care, which just kind of returns some of that autonomy that's been lost in the commercialization of the healthcare system in America.
Now, there are all different legalities depending on what state you live in. I know in California, I only need two people who aren't family members, aren't related to me, and who aren't my POAs to bear witness, to sign. And that's all we need. But different states have different legalities, and I was wondering, how does a platform handle that?
Yes, so we handle each certification pathway based on state law. So whether it's two witnesses, whether you need a notary, some states want to encourage two witnesses and a notary. So there are different pathways to certifying these documents, and the technology and the application just comes up for you. So if you are in California, you have the two witness pathway. If you're in Minnesota, it might be the two witness pathway as well. So wherever you are in terms of filling out these documents and getting the certifications, pathways are appropriately pulling up for the individual. So there's no headache there in terms of making everything legal and binding, and then really taking this information and educational mandate, which is what these directives are, and making them just more powerful by following the state laws.
How do doctors feel about this? Because I know you've met with different hospitals and different doctors. Are they excited that, because this is going to hopefully, this will make things easier for people and will help with that communication between family members?
Absolutely, absolutely. They're really excited that there's market solutions out there like Thanacare that are pushing this forward, because it's always too little, too late. It's always having to do these advanced care planning documents in the ER right at the last minute that the internal medicine doctor has to yet again do. And it's really tough to have these conversations with people in that situation, and you just met these people. It's for the first time. For a lot of the time, it's like, hi, I just met you, my name's Sam, let's talk about death. I mean, what a juxtaposition. Like, that's just not a healthy way to go about it. So doctors are really excited about this. We're working with a number of different systems to really look at different populations. So whether you're an ESRD population, or maybe it's a rural population, depending, it's a geographic uh, issue as well. People can't always drive 90 minutes to have this conversation. So we're going into the hospital, we're going into the homes, and we're having these conversations with individuals so that they can save a trip, but then their information is communicated back to the hospital that they're most intertwined with.
Yeah, I know at the beginning of this conversation, you talked about how you saw that there was such a disparity between how people are treated depending on, where they live or financial factors, or how is Thanacare helping with that? Because I know and we're not going to talk about cost, but I know that there is a minimal cost, right? And how about people? How do you support those communities that just don't have that?
Yeah. So those communities that don't have that they're generally accessing their health, they're generally distrustworthy of the healthcare system. They're usually outside of the traditional healthcare system, and so they're going to their community leaders, whether it's a father or a pastor, or it's a local nurse that is doing work within the community. So we're going directly to those leaders within the community and giving them the technology at a reduced rate so that they can effectively have a personal community EMR as it relates to goals of care. So we're giving the tools to the people who are trusted within the community, and then they're doing the work to then build that conversation and build those documentations, and then ultimately give them to the people to ultimately give them to the healthcare professionals that they unfortunately have to see from time to time.
Yeah, that's really wonderful, because we do, it's so easy to talk about this when you live in a city, or you live where this is much easier to do, where we're more exposed to these conversations. Hopefully we're more exposed. So that's so for people who are just starting to have these conversations with their family members or with their friends or whoever, what is the starting point? What do what advice can you give people who are just starting off having these conversations, or thinking about, oh, what should I be doing?
I think I think it's battling misconceptions. I think that's kind of that one of the healthier places to start. So like, perhaps one of the greatest misconceptions about medical care within the hospital setting is that the consequences of invasive treatment are, fully disclosed to patients and their families. Let's be real clear that that's not always the case. So specifically speaking, when individuals are seriously ill, these difficult conversations concerning, what does a new baseline mean for me? If I'm successfully treated, and that's air quotes, successfully treated, what does my life look like now? So at the beginning of the day, I'm an individual that begins this day in this way. Maybe I was running on a treadmill as part of my daily exercise routine, or I was living independently. But we might have had a massive stroke, or we might have had a fall that severely hurt us. So now we're in the emergency room and we're being aggressively treated. That might not restore us to where we were and where we came from at the beginning of that day. So really understanding what those misconceptions might be for me as a healthcare system, or for me as a healthcare person going into the healthcare system, and baselining ourselves so that we could kind of say, okay, it's not it's I can't just go in and come out and I'm going to be the same person as I was, and how do I protect myself against that? So I think really starting there.
There are people who won't get better. How about people who have something like dementia? I know there is a lot of talk about how we support them through advanced directives, and what needs to change with that advanced directive. What are your thoughts about that?
Yeah, I think the advanced directive is naturally evolving into a bunch of very specific advanced directives. What I mean by that is there's a dementia directive out there, or there is an ESRD directive out there, or there's an oncology directive out there. So becoming really specific with the directives and what you're filling out will just put a little bit better guardrails around the eventual care that you might see. So as it relates to the dementia directives, I think that's something that a large number of Americans are increasingly experiencing, and it's something that a lot of great organizations are putting their hands around and helping support. The idea that Thanacare is helping to do that is a strong one. We have our own dementia directive that individuals are using. And one of my greatest joys as a non-medical person that I've watched has been dementia patients videotaping themselves and affirming their wishes via video. And they may have forgotten 6 months later or 9 months later, and they rewatch a video of themselves saying, "These are my wishes." And it felt magical to say that, like, okay, here's something that we've done that allowed them to um, basically just kind of um, straighten up again and say, this is the care that I want because this disease has taken a hold of me. So it's it's been a really powerful thing to watch dementia patients utilize standard care in that way.
In the future, what are your hopes for, not only end of life care and planning, but for Thanacare also? What do we see coming around the corner?
Yeah, well, we spend so much money at the end of life in this country. It's upwards of $250 billion a year that is really taking a strong toll on people. And this idea that we are just going to treat ourselves and we're going to get better somehow. That's that misconception that I want to fight. So this over treatment and medical expenses are a really big issue in this country. It's a real issue in this country. People are losing nest eggs that they fought and earned and protected over decades to over medicalization at the end of life. And it's leaving families broken. It's leaving families poor. It's leaving families in a such worse off place than where they were when the disease may have begun. So protecting families, financials and happiness is where I hope this country can get to, because we're not there right now. Too many people are leaving broken, and we hope that Thanacare is just one of the swords that is helping combat that. Because it's not just going to be us; it's going to be a legion of people like yourselves and who are out there helping to get people to plan and get people to have those documents and decision makers in place to protect against that uh, awful experience.
Well, Sam, thank you so much for being here. I really appreciate it. Before we wrap up, could you please tell our listeners how they can learn more about Thanacare and get in touch with you?
Absolutely. So you can go to www.thanacare.com. That's THANA care.com. We're on Instagram as well and LinkedIn as well. And we're kind of all over the place, really interacting with all these deaf professionals and seeing how they use our tool in their communities to better the people around them and to help improve the workflows, which they're very important and very crucial to really bettering the end of life care in this country. So thank you very much for having us today, Traci. It's been a pleasure.
You're welcome, and thank you for reaching out. I remember when you say you reach out to deaf professionals and you really get a feel of what we're going through and what our clients are experiencing also. And I can say from firsthand experience that that's true. You've come to us and you've really said, okay, what do we need to update? What can we make better? So I really appreciate that. Thank you.
Thank you.
So, folks, we've covered a lot of important ground today, from the critical need for an advance directive to the importance of clear communication with medical staff and loved ones. Hearing the stories Sam shared reminds us of why planning and documenting our end of life wishes is so vital. By taking these steps, we can ensure that our desires are respected and that our loved ones are supported during difficult times. Thank you for joining us. If you've any questions, please comment below or reach out to me directly. And if you found this conversation to be helpful, please like, share, comment, and subscribe. This is Traci Arieli from Comforting Closure, wishing you peace and comfort in your journey. Until next time, take care.